Yo, what's going on YouTube? I have a question, and this is actually a serious question because I'm sure there's some of you guys out there who are more so up on their game in terms of, this whole healthcare debate discussion, Obama's plan and, who likes it and who doesn't like it. I'm kind of torn, and I'm more so still confused because I have a different understanding of how healthcare works. Now, a procedure is a procedure. It's going to have a fixed cost, and you also have to pay the doctor, right, for performing, any sort of procedure, especially if it's high risk. Okay? So for me, it doesn't matter who pays for it. So when I hear the whole idea of cheaper, high quality healthcare, okay, the word cheaper is very misleading, right? It's cheap because maybe you don't have to pay for it, but who exactly is going to pay for it? There is no half off or, I'm having a sale, come get this procedure done for 75% off. Yo, that procedure is going to have a fixed cost, and the doctor's going to want his fair cut. Because if you start to, somehow cheapen, right, the doctor's cut, you start to lower prices from a business standpoint, you're going to cripple the healthcare industry. What we don't understand is that, the fact that we have high quality healthcare, maybe not available to everybody, right? But the fact that we have it is purely based off of the fact that it's privatized and there's money to be made. Okay? If there was no money to be made in healthcare, doctors wouldn't, incur all this debt before they actually made money. Right? There would be limited research in this industry because there's no money to be made. Whether we like it or not, we're a capitalist society and we're driven off of business money. So if there's no money to be made, you're not going to really see any sort of innovation. So if you start to mess around, right, you're going to have, different researchers and different firms who are going to pack up because they don't stand, you're removing that financial incentive. So in my eyes, I'm like, the doctors and all the other related positions aren't necessarily gonna, stand for people messing up their business, right? Don't start messing with the cost of this procedure, this surgery, this treatment. Don't start messing with my money, right? Don't start messing with my money. So I'm like, who's gonna pay for this? Who's gonna front the bill? Right? For those who are getting cheaper, high quality healthcare, who's going to pay for it? Right? There's so many different dynamics going on that it's not even funny. I mean, you look at the healthcare industry or health insurance industry, right? A lot of people don't know how they work. They make money off of denying your claim. Right? Healthcare insurance doesn't work off of, approving people's claims. It works off denying them because the procedures are way too much. You know how many signatures you need, right, from your healthcare insurance company before they authorize you to get any sort of surgery? You know how many, hoops you have to jump through? Because if they paid for everybody's surgery or major procedure, they'd be bankrupt because it's so damn expensive. Like I said, the cost of doing business will always be fixed. It's just a matter of who's paying for it, right? We already know that the healthcare insurers don't want to pay for it. That's not how insurance works. It works off of, like I said before, saying, no, you're not authorized for this procedure. Sorry, you're not covered for that, or X, Y, and Z, or, you don't fall under this category. That's all the loopholes that they have to trick you. So who's going to pay for it? So for me, I definitely still have to do my research. And it's not an easy conversation to have, but it's part of the cons of the society we live in. Living in a capitalist type society where people can make a whole bunch of money, right? That drives our innovation. And if you start messing with that, it's like throwing a wrench, right? And a big working machine. Right? All you need is a little screwdriver, and it can literally bring down a big, massive system. Because it's unfair for the government, and it's not proper for the government to say that we're going to help out, because them helping out is nothing more than them using tax money. So in a sense, you're using my money. And that, to me, is kind of like, the whole misleading part in terms of what I hear. As soon as the government talks about them stepping in, well, you're stepping in with what money? Money that you got from taxes. So, even after talking with a friend of mine who's at med school right now, he talked about how, this whole high quality healthcare is a myth. Right, and he's the one that told me, yo, you know how expensive, an MRI is and all this other stuff that people get? Do you know how expensive it is? Right? Do you know how much the doctors make for, doing that? You're not going to mess with that. Trust me, America doesn't want to mess with that. And those were his words exactly. And he talked about all you're really going to see is a rise in pharmaceuticals. So if you're some pharmaceutical firm out there, you're probably, standing in the shadows, licking your chops, right? Rubbing your hands together because you can't wait. Because there's a difference between over-the-counter pharmaceuticals, drugs and all that other stuff, whether it's over-the-counter or a prescription, versus actually solving problems and procedures. Right? Most of the time when we take over-the-counter drugs or a prescription, it's more so to cover up a problem. Not necessarily to solve it or eliminate it. It's to cover it up, almost like a painkiller. Let me lessen the pain. Let me hide it, right? So every now and then you go back and do what? You get your prescription refilled. That's why you hear stories about people being addicted to their over-the-counter drugs or their prescription drugs. Right? We all saw what happened with Michael Jackson. And so he talked about, you're probably going to see that. Because even if the government wants to step in, they'll quickly realize that, these procedures are way too much money. Way too much money. And they're going to turn into, the healthcare insurance industry, where they're going to say, oh, you're not going to get that. Here, take these pills, come back in a couple of weeks, take some more pills, and that's how you're going to deal with it. So you're not going to really be providing high quality healthcare anyways. You're just going to be, handing out prescription drugs here and there. Because that's the only realistic, affordable solution to, kind of attack this problem. Right? There's people in the middle class who need procedures, who need surgeries, that don't get it because it's too expensive. Even with them making good money, even with them having a pretty comprehensive healthcare insurance policy, it's still too expensive. Right? So who's going to front this bill? If the people who actually, can somewhat afford it can't even afford it, who's going to front the bill for those who clearly can't? So like I said, you're more than likely going to see, a whole bunch of prescription pills and over-the-counter pills go up in usage, because it's the only way to deal with the whole available healthcare for everybody. But I wouldn't call it high quality at all. It's just too expensive, y'all. And you can look at how other countries do it and look at the pros and cons. Sometimes people get confused because, some other country, everybody has healthcare. But look at the quality as opposed to in America. That's why people come to the States. That's why, as a Nigerian, right, we bring our parents over here when they're sick and they need help, and other countries do the same because of what we have over here. The quality of our health care is backed off of the knowing that you can make millions and billions of dollars off of it. So anyways, you guys tell me how you feel. Please, if you can educate me, please do so. Take it easy. God bless.